expected to increase by 20 to 25% in the first year alone, and then would double by the year 2026, the next 10 years. Pre-existing conditions. Now this is a fun one. So this is one of the few things that in all the years that I've been talking, all those 4 or 5 years that I've been talking about the Affordable Care Act, where it seems like both Republicans and Democrats seem to agree. They think it is abhorrent that there was a time immemorial where people could be denied healthcare coverage because they had what was called a pre-existing condition. Well, get ready to go back to that, because even though both sides of the aisle seem to agree on that, you cannot have, and you can quote me on this, you cannot have the prohibition on discrimination for pre-existing conditions without the individual mandate.
Exactly.
Tells you otherwise is blowing smoke. It just doesn't work. And I'll tell you the main reason for that is because the insurance companies won't let it happen. It makes no sense for them. It makes no sense for the American people. They'll be working, trust me, behind the scenes on this, harder than anything that you can imagine. So, if you have a problem with discrimination because of pre-existing conditions, you need to fight, you need to advocate to make sure that that horrible individual mandate remains the law of the land. And with that, I am going to try to end early because I'm sure these guys have a lot more interesting stuff to say. Thank you very much.
Good evening, everybody. Thanks for the opportunity to come here and speak and hopefully answer your questions. I know a little bit about healthcare. Ross, you do yourself some injustice there. But one of the things I like to challenge my students when I teach health policy is to ask them, imagine that you are appointed the health minister of a brand new country with there's no health system existing there, no nothing. You have the opportunity to just design a brand new health system from scratch. You know, how would you do that? Well, you would never do it. You would never design a brand new system like the U.S. health system. And I think everybody agrees. I think that's a bipartisan agreement that the system we have is just not well designed. Now, it doesn't mean that the care you receive is bad. It doesn't mean that your doctors or other healthcare providers are bad. In a lot of cases, the treatment and doctors are the highest quality in the world. But the system just doesn't make any sense. It's wasteful, it's costly, we don't get good health outcomes given the amount of resources that are invested in the system, and there's major inequities. And one of the biggest inequity is that we have a large population, or have had a large population of people who don't have health insurance coverage. You know, so our system, you have to understand our system is not because of some grand design that a bunch of smart people got into the room and said, yeah, this is the way to design a health care system. It's largely an accident of history. It just kind of evolved the way it is. You know, it's been largely a private system, and then we've had programs like Medicare, Medicaid, other programs that have come along to try to fill the gaps for people who fall through the cracks because they can't afford private health insurance, they don't have a job that offers them private insurance. And so you have to understand, you know, there's a lot of talk about, well, the Affordable Care Act has such high costs, the deductibles are high, why, you know, why is it? A lot of this is structural, it's endemic to the system. It was here before the Affordable Care Act, it will go on even if the Affordable Care Act is repealed. That's just the way the system is. And so what the Affordable Care Act has done is it's been the biggest gap filler probably in the history of the US. It is not a major restructuring of the system. The system, as we have known for the past 100 years or so, is largely the same. What it is doing, it is trying to provide coverage for people who fall through the gaps, who don't get coverage through their job, or they are too poor or low income to afford care on the private market. Now, to kind of put into context what the Affordable Care Act has accomplished, I've been sort of doing health policy research for the past 25 years. And every September, there's a national survey called the Current Population Survey. And that is the foremost survey that has been tracking health insurance coverage and the number of uninsured. And so every September, it's kind of a big deal when that number comes out. And for almost all of my career, over the past 25 years, I have seen that number tick up. You know, started maybe at about 35 million in the late 1980s. Then it exceeded 50 million, 55 million. And then in the space of 2 years, the Affordable Care Act reduced that number by 20 million. I mean, that's just unprecedented. You know, even with all the imperfections and inequities of our system, in the space of 2 years, to reduce the number of uninsured by 20 million is a major accomplishment. I mean, it's unprecedented in our history. And so I guess the question is, going forward, what do we see? Well, I'm a researcher. I try to be objective. I try to be nonpartisan. And yeah, there isn't a complete and detailed plan that's come out, a replacement plan that's come out. But what I see isn't very encouraging. And part of this is because the plans are being driven by ideology. The basic idea is that if you make people have more skin in the game in their health care, then, meaning you're going to pay more, then you will be able to choose more wisely, you will be more efficient consumers of health care, and all the problems of the health care system that have existed over the past 100 years will be solved. So it's your responsibility to fix all the problems in the healthcare system. That's kind of the gist of what we're kind of seeing coming through. So anyway, I'll be happy to answer questions that you have.
Really very, very happy to see all of you tonight, and thank you so much for inviting me to be here. There are some very, very real threats right now to healthcare, and Peter and Ross initiated that conversation a moment ago. And I do think what's happening in DC is very dangerous. There are people who want to turn back the clock on the progress that we've made in healthcare over the past decades. And we're talking decades. Let's go back to Medicaid and Medicare. That's 1965. So we're talking about decades where this country's been trying to improve its system of healthcare. And millions and millions of Americans will be in jeopardy if some of these ideas become the law of the land. I do want to talk about the Affordable Care Act, but it's really, really important that you know there are other threats to other health programs right now in Washington. So I'm going to talk about the ACA, Medicaid, Medicare, and the Children's Health Insurance Program for low-income kids, because all that stuff's on the line right now. So first, talking about the ACA, I have worked as an insurance navigator for the last 4 years, running a project out of the Virginia Poverty Law Center, and Virginia's had very successful enrollment through the federal marketplace. This year, open enrollment just ended at the end of February. 410,000 Virginians enrolled in marketplace coverage. That's fantastic, and most of those people get tax credits which help them pay for their health insurance premiums. They get tax credits on average of about $275 a month. So a lot of people are paying $75 a month for their comprehensive health insurance coverage. We have people we've worked with who pay $20, $10 a month because they're just above the poverty line. They can go to the marketplace. They get very substantial tax credits to help them get affordable health insurance. It is an enormous, enormous achievement, thinking about 20 million people gaining health insurance as a result of the Affordable Care Act. And that's a combination of marketplace coverage and Medicaid expansions, which of course, we know Virginia did not expand its Medicaid program, right? Which means that there are over 200,000 Virginians who are still in this very miserable insurance gap where they're too wealthy to get Medicaid, but they don't have enough money to go into the marketplace. Those people, that's been one of the hardest parts of being a navigator, is all the folks we encounter day after day who fall into this Medicaid gap. And it's, you know, kids who age out of Medicaid when they turn 19, it's people who are disabled who are waiting for Medicare, it's people who are disabled but trying to get declared disabled by Social Security. Lots of people fall into that Medicaid gap, and it's really awful. So when the opponents of Medicaid expansion talk about, oh, this is only for able-bodied adults, that's not true. There are a lot of, you know, young people and sick people, cancer patients, chronic diseases, all those folks also fall into the gap. Now, there's plenty to do to improve the Affordable Care Act. I think it should be, the new word these days is repair. You've heard some congressmen talk about repair. That's a victory for us, okay? Because we started, the debate really started with repeal, period. Right? Then it was repeal and delay something. Then it became repeal and replace. And now we're hearing repeal and repair. It is a victory. Let's keep pushing them so they get rid of the first word so we don't talk about repeal anymore. I think that's really important. So our advocacy is working, and we just can't let up. But all of us who have private insurance, employer-based insurance, all of us are affected about because of any changes made to the Affordable Care Act. You know, all the consumer protections, if they are going to replace the Affordable Care Act with something, we need to make sure that all of the consumer protections are retained. You know, access to coverage despite pre-existing conditions, keep those adult children in their parents' plans till age 26. No lifetime limits on coverage, no annual limits on coverage, limits on out-of-pocket expenses, preventive services without a copay. I mean, we're all getting free flu shots, but we're also getting free mammograms and colonoscopies. It's really important. Another part of the ACA that I think has been really important is the medical loss ratio requirements that require every company to spend at least 80 cents on every premium dollar for actual health services or healthcare improvements, not profits and not CEO salaries, etc. So the medical loss ratio is something else that I think is important. I'd love for Peter and Ross to talk about that maybe later. And as Ross pointed out earlier, the only way for all these consumer protections to be continued is to require everyone to have insurance. That's the only way to keep your risk pools healthy. All of the proposals I've seen so far coming out of Washington, and there have been several blueprints presented, all of them fall far short of protecting all those things that I've just mentioned. Turning to Medicaid, because there are really very serious threats to the Medicaid program right now. And just to give you context, there are 1 million Virginians who get Medicaid. 1 million. Most of them are children. Over 60% of Medicaid recipients are children. But also Medicaid is really the only game in town for long-term care services. People who need nursing home care, people who need long-term community-based care because of their disabilities or age. Many of those people are getting, well, most of those people are getting their care through the Medicaid program. And the discussions about Medicaid are really scary to me. Paul Ryan and Secretary Price, our new HHS Secretary, they would totally change the structure of the Medicaid program and turn it into a block grant or impose per capita caps on that program. That totally turns that program on its head. Today, Medicaid is a joint state-federal program where the states and the federal government share in the costs. In Virginia, it's a 50-50 match. So whenever Virginia changes its program or more people enroll, the federal government pays half of the cost. Both of the proposals, block grants or per capita caps, are designed for one thing only, and that's to save the federal government a huge amount of money. So guess who is going to have to pick up the tab? States, right. And by capping the federal dollars that come into the states, what are states going to do? They could raise taxes, okay, but you know, which states are going to do that? Really, the only choice is going to be to cut the programs, cut services, cut eligibility, cut reimbursement. I mean, it's just a no-win situation for states. So both block grants and per capita caps, don't let people say, well, per capita caps are a little bit better because then at least if more people enroll, you'll get some more money for new enrollees. They're both terrible. They both cap federal participation in the program. And it's going to lead, if it happens, it's going to lead to rationing of care to kids, seniors, and the disabled. And states will not have the ability to use their Medicaid programs as they can now to deal with things like natural disasters. Think about Flint, Michigan. They use Medicaid there for all the water problems they had. Think of Zika. Think of recessions. You know, it's a counter-cyclical program. When we have a recession, more people come into these programs, more people have needs. How about medical innovations? Don't we want the program to be able to adjust and pay for new technologies? And of greatest concern are just the special needs of children, of elderly, of the disabled. People who have those very, very high needs, those people who are very, very expensive, Medicaid programs have to be able to meet those needs. So again, folks who are promoting the idea of block grants or per capita cap, they say, well, let's give states flexibility. Well, this is more smoke screens, and we've been talking a lot about smoke screens tonight. It's not more flexibility to states, because if you cap the programs, the only way states will exercise flexibility is in figuring out how to cut the programs. Definitely not how to make them better or to meet the needs of their individual states. So it's already true that Virginia has a very restrictive Medicaid program. As I said, we don't have Medicaid expansion. We're also ranked, we've talked about some state rankings, we're ranked 47th in the country in per capita Medicaid spending. Yeah. So, you know, this is also quite important when you're talking to your congressman about opposing repeal of the ACA. Please also oppose block grants and per capita caps on our Medicaid program. And just right before I sit down, I know I've talked too long, but there are threats as well to Medicare. There are people in DC who still would like to privatize Medicare and give people vouchers for their Medicare coverage, and that would just turn the whole thing over to private insurance companies and probably raise out-of-pocket costs for seniors. And our CHIP program for low-income children is sitting out there. It's been a very successful, popular program for children who have family income above Medicaid levels, but that program is going to run out of money this fall. So unless funding is provided. So there's a lot of work ahead of us, and look forward to your questions.
Franco, you can go ahead.
Right here. Right here. Oh. Me? Okay. Sorry.
Sorry, go ahead.
I mean, I wasn't sure where to go or not.
I am 64 years old. I would like to know if I will live to see single-payer health care.
Would you say you're a healthy 64 years old?
I'm not sure my 23-year-old son will live long enough to see that. Ultimately, it comes down to politics, and the healthcare is one of our biggest polarizing topics, and in this age of fake news and alternative facts, there's a lot of terms that are thrown out, like socialized medicine, that sends shivers down the spines of a lot of people.